Hello? Yeah, it's basically to do with surgery. I know with CMT, I work full time. I've got it in my feet and my hands. I'm having minor surgery on my feet, but with me, a lot of it affects worse in my hands. And with doing manual work, I've asked my doctor to see if I could see somebody to probably straighten my hands. But with doing manual work all the time, I was worried if I did have some sort of surgery or to straighten them, if it actually would weaken, you know, because I work full time, I need to work full time. Would it be beneficial or to stay as I am?
Okay. First of all, it's difficult to comment on a particular person, you know, without having seen you as a patient. But I think the difficult thing about surgery, of any orthopaedic surgery, it's generally aiming to correct a problem orthopaedically. It won't make weak muscles stronger, and it won't do anything for the CMT. So there are different kinds of foot surgery, and it tends to be individualised. The hands are quite a bit simpler because we're not as good at doing surgery on them. So a lot of problems with hands are due to weakness. The hands claw like this, and that's difficult to straighten. What surgeons are pretty good at doing is if people have lost that function, it's the pinch. If that's gone, sometimes you can do a tendon transfer, which is very successful. But to do that, the surgeon has to work out, is the tendon working well enough to do it? So I think that what someone with a problem with their hands would do is get an opinion from a hand surgeon. It's important it's a good hand surgeon as to whether there's anything they could do. But what they'll be looking at is there a function they can give you back. So if you say, well, you straighten my hands, they won't. But if there's a particular function that they can help with, they can look at that. So I've seen some people have very successful surgery to get that back, a pinch, or occasionally to get some movement back in the thumb, but it depends on individual person. And they would tell you then whether it's unlikely to make anything worse, but you're absolutely correct. That's a very important question to ask them, why they're doing it and what they're doing. So I think it's no problem getting an opinion, but I'd get an opinion before committing to surgery.
Thank you. The next question is from Joan Stammers. Is that lady here?
It was about exercise. Will I read it for you? So you said, since the reaction time tripping is slower in patients with CMT than those not affected, could this be improved with training or exercise? I think that's a very interesting question. So up till not that long ago, people with CMT, and certainly I see people now that were seen 50, 60 years ago, they were told exercise makes CMT worse. And all neuromuscular conditions were the same. Muscular dystrophy, everyone was told it made it worse. Now, that was based on a particular condition which is totally different, and it's wrong. But it's taken an awful long time to come back from that. And we're now only beginning to show in neuromuscular conditions that exercise is good. So one of the issues is, if you do exercise, it helps keep the good muscles fit and aerobically fit. But if a muscle is wasted because the nerve doesn't work to it, it won't bring it back. So your particular question, the reaction time, generally it won't help that, because that's due to if you fall, you really aren't good at correcting things because of weakness. But actually what physio is very good doing, and it might sound like a weird thing, but they teach you to fall properly. So it's not that you can correct the reaction time, but it's to prevent injury. So you can learn to be more stable and to prevent injury, but it won't quicken the reaction time. It just makes you do the right things when you fall or when you trip.